series of question and answer round, and it has been a beautiful and a wonderful pleasure to do these rounds on one. The best part of this is that I am able to take up questions which you have asked on the portal, which you have asked on the feed post, which you ask in the mom's chat group, and it becomes very easy for me to collaborate all these questions and then take it up for our understanding of how do we identify the problems or what would be the probable solution and so forth. To begin with our next set of questions for today, which belong to pregnancy, lactation, childbirth, child tantrums, we all have to understand that these are all the arenas where we talk about. Second foremost thing is that we always are always worried that this is going to happen to me, this is not going to happen to me, it is going to be very painful. These are all mind thoughts. So I would just like to say that when you're talking about your problems, when you're thinking about a solution to your problems, we need to stay very calm, very quiet, and have a very pleasant mindset. It is very easy to say, but it is very difficult to follow it, because the key is consistency. The key is, performance which enables you to be on the right track at the right time and at the right moment. So, without any further ado, there is a first question from the user which tells us that मेरा बेबी 5 महीने का है और उसको हेयर फॉल हो रहा है और उसके बाल दिख रहे हैं. शुड आई बी वरिड या मैं क्या करूँ? Now, over here, this is a very interesting question, because a hair fall for a 5-year-old baby due to could be due to the scalp not being formed properly, or due to some vitamin loss, or due to some product which is not working in favor of the child. Now we can look at it at three aspects. कि जो जन्म के बाल होते हैं उनको निकालना होता ही है, लेकिन कुछ समय के बाद. बट हेयर फॉल कितना हो रहा है, बहुत ज़्यादा हो रहा है, या स्कैल्प के ऊपर ही दिख रहा है, या कहीं और भी अगर बाल झड़ते हुए नज़र आ रहे हैं, तो हमको सावधानी बरतनी है कि हम कौन सा प्रोडक्ट यूज़ कर रहे हैं. दूसरी बात है कि आप एक बार डॉक्टर से बात कर सकते हो, जिसके लिए आपको ये भी समझ आएगा कि केमिकल फ्री प्रोडक्ट्स यूज़ करना बहुत ज़्यादा ज़रूरी है. ऑन बेबी चक्रा यू कैन ट्राई आर oils which are especially for hair. So you can try up on using these baby chakra specific oils which are organically made. They do not have any chemicals and they are easy for the baby application. And definitely you will see that the hair fall has stopped, and there has been a switch from hair fall to hair growth, which makes it really beautiful, and your child would have good voluminous hair. I hope this helps. I have another question saying that, ma'am, I am 6 weeks pregnant. My hair fall is heavily. What do I do? Now, that was for a child, and this is for a mom. I would just suggest that this mom, due to the hormonal changes in the early times of pregnancy, there is a problem that hair fall could be seen. So, we need to understand that hair fall during pregnancy is quite common. Second thing, we have to understand that it could be due to hormones. Third thing, we have to understand that you can use home remedies, like you're using fenugreek seed powder, or you're using curd, or you're using probably onion oil, which will work for the hair growth to happen in a very normal way. So keep these applications handy. You can go applying these oils on a regular basis, or what suits your convenience. It will definitely help you for having a good hair volume, and help you to have a thick hair thick hair and stop the hair fall. See, hydration is also something which I keep telling, very important. And we also have to identify that hydration is a part of our day-to-day routine. So this is going to be helpful for our body as well. Now, my next question is from a pregnant lady. She says, I have had posterior placenta till now, but now that I'm going to the doctor for checkups, it is showing anterior position. Is it of any concern? Please help me. Now, I would just like to tell this mom that since all these scans, it was the doctor had been telling you about posterior placental position, and now the doctor has told you that it is anterior. So there is need. It's a no. It's a question to understand why this is happening. Firstly, the baby is moving in the womb. Because of the baby's movement, the placenta is also moving. Having it at posterior end was an advantage, but having it at the interior end also is an advantage. You need not worry so much about this at this point of time. You only have to understand that when the child is being delivered, the child has to be delivered in a very healthy and a very safe manner. Placenta is something that provides oxygen and nutrition, and you should be continuing having a healthy diet and also staying hydrated, so that the last few weeks, which are very, very important for evaluating the growth, evaluating the weight of the child, it becomes necessary and it becomes mandate. This has to be mandatory structure for yourself, so that the growth of the child is something now to look forward for. Need not worry, nothing is going to be harming your baby. The next question that the mother has asked is, I am 9 months pregnant, and I have pain while I'm passing stools. Is it safe to take any kind of a medication during this time in pregnancy? And also, if the medication is prescribed by the doctor, who is an assistant doctor and not the main doctor. Now, I will put this into two aspects. Even though the medicine is being prescribed by the doctor, by the assistant doctor, and not by the main doctor, trust your doctor. Second thing is, since you are having pain in the stools, while passing stools and there is blood, we need to understand why this could be a problem. One, it could be constipation related. One, it would be putting pressure on your body systems. And third, it would be, passage of stool could be hard. So, for passage of stool to be in a proper way, have a lot of fiber in your diet. Second thing is, drink a lot of water. And third thing is, even though the medication is given by the assistant doctor, I would suggest you that please take up this medicine because it is by the trusted source. Do not take any self medication. Follow the instructions. If there is a symptoms are they have come down, then that is good. But if the symptoms have been elevated, then it would be a problem for your health. Please seek a doctor's help immediately. Next, I would like to take up a question by the user saying that my baby is 5 months old. Can I start feeding my baby solids? The only point over here I would like to say is that, hi, mom. You're doing absolutely fine. Continue breastfeeding your child for another 1 month, and post 6 months, you can start giving solids. Please also have a look on the articles that I have written on how do I start complementary food. Second thing is, solids is some semi-solid food is something which the baby's body is ready to accept in a very diligent manner. We need to start with a very small quantity in the beginning, and then as per the baby's demand we can increase it. So wait for a month till the time the baby's body gets really, really ready for all these things. Another question by the user is that, hi, my baby cries when he passes motion, and when he passes motion it is too hard. What is the reason and what should I do? Hello, mom. Now, since this is something new to you and this is making you worry, so I would just suggest you that babies do have a lot of constipation problem. and that is the reason they are passing hard stools. So we need to do two things over here. One is from the diet aspect and one is from the massage aspect. Once we can start massaging the baby tummy, you put a massage oil on the stomach, you do a clockwise massage, or you do a anti-clockwise massage. This is going to help your baby to have a little comfort onto the abdomen. Second thing is, also understand that when you are massaging, is the baby passing a lot of gases. That could be due to the hard indigestion problem, and because of which this problem has occurred. And the third thing of it through the diet is, if you're still breastfeeding your child, I would continue saying that take enough fiber in your food, stay hydrated, have lots of fruits and vegetables, and that will help for the passage of stools for the baby in a very easy manner. Do understand that this would be common in summers as we try to drink less amount of water, or we don't have the satiety feeling of having any kind of food. So all these parameters can be taken into consideration and can be evaluated at the time when we are seeking our child's help. I hope this helps you to understand in a very clear way, and also helps you to guide in why the passage of stools can be difficult when there is less water or the baby gets constipated due to other reasons. Okay. Our next question by the user is that uh, I am having too much of hair fall post delivery. I have delivered a baby just 3 months back, and my hair fall is severe. I have got patches on the scalp. What should I do? Well, first of all, congratulations. You have just delivered, though it is 3 months, but still that is a beautiful journey to motherhood that you have come in through. I would like to address this question in a very simple and a subtle way, expressing that hair fall is very common post pregnancy due to the hormonal changes. Okay, there are procedures, there are ways wherein we can apply homemade remedies which will help us for stopping or giving us a reducing the severity, but these are all home based remedies. First thing I would like to say that hair fall, for new hair to come up and the volume of the hair to increase, what we require is real good source of proteins, which could be dal, which could be pulses, which could be legumes, which could be milk and milk products, which are very beneficial for you. Second thing I would say, have small and frequent meals which are very helpful for you. Third thing I would say, as a home procedure, take methi seeds. You can crush them and apply the powder onto the roots of the hair. Leave that powder for at least 15 to 20 minutes, and then before having a head bath, you can just remove the powder by just putting up water. Do not use any conditioner or any shampoo, and definitely you will see that methi seeds play a very very effective role in helping to reduce hair fall and having good growth of hair. Second thing is, you have to understand, because of the hormonal changes happening, you might lack some vitamins and minerals, which could be sourced from any kind of a tablet, multivitamin tablet, which will be helpful for you and your health. So this is how it will be beneficial and it will work in your favor. Next, we will go for a questions which says, my baby is 3 months old and is taking around 75 ml bottle feed around 7 to 8 times a day. Is this quantity enough? Well, for a new mom to understand that formula feeding is something which we really, really don't recommend. We are always looking forward for giving breast feeding, and if there is less amount of breast milk, then there are ways. There are galactogogues, that is natural agents which kind of help to improve the breast milk, and definitely this will be working in favor of the child because he would be getting natural mother's milk. Secondly, if breast milk is not possible and then the doctor had asked you to put a baby on formula and using a formula milk with the help of a bottle, then I believe that there are different instructions written as per the kind of formula that you are choosing. But remember, 7 to 8 times a formula in a day makes the baby a lot constipated and has a lot of gastric issues, and sometimes the digestibility of the formula also becomes very very difficult. So whenever you're feeding the child, ensure that you are using a combination of breast milk and a combination of formula milk, and this is how it will be helpful for the baby to digest milk in an easy way. At this stage, we cannot introduce Cerelac or any other food. We will be only concentrating on the milk, which mother's milk, which is ideal for the baby's health. I hope this answers your question. Our next question for the day is, it's been 40 days and I am having irregular bleeding. Is this normal? Well, I would say congratulations, mom. Welcome to motherhood. It's okay to have, irregular bleeding in the first 40 to 45 days, which could also continue up till 2 months. This is quite normal. This is happening because of the irregular hormones, and also that you are breastfeeding. So your breastfeeding is controlling your hormones, and the bleeding would be taken care by the body in the other aspect. Second aspect, I could tell you that you could also have delayed periods because of this, and there is nothing to worry. It is very very natural and very common, and so I believe that this might have helped you to understand that this problem is common, so need not worry upon it. Our next question by the user is, my baby is 19 days old. He's just been detected jaundice. Doctor has asked me to get admitted in the hospital, but when I checked the reports, the level were very low. Now, what should I do? Now, first of all, congratulations, since your baby is really, really new, a few days old, and jaundice has been detected. For a safer side, it is better to go for a day's phototherapy, which helps to evaluate the jaundice level and brings the jaundice down. Second thing what you can move on is, you can always expose the baby in the sun in the early morning hours between 7 to 8, just for 10 minutes. Keep the baby's bare minimum clothes, and keep and expose the baby into the sunlight, because this will help for the jaundice to come down. I would like to tell you that jaundice is very common phenomena after the birth, and definitely phototherapy, a combination of phototherapy and vitamin D exposure from sunlight helps to reduce jaundice, and this will be coming down in a week's time. So need not worry about it. Our next user has asked us a question: how do you clean baby's wax? Wow. Now that's something very tricky, but something very useful and has a purpose. We do not use any cloth, we do not use any earbud, and we do not use any other material to clean the baby's ears. Just leave it as it is. This is very important. However, how much old your baby is, whether the baby is 0 months, whether the baby is 3 months, 6 months, or whether the baby is around a year, we do not insert any earbud because that could cause damage to the ear. Second thing, if you want to remove the dirt from this, just take a cloth, and probably you can put your finger inside the cloth, and that will help you to clean the outer area of the ear. Even the doctor tells you not to put any oil drops in the ear, because that will also cause infection. We also know that the child is very small, so we do not add any ear drops in the prescription which is recommended by the doctor. I hope I am very clear on this. Till the age of 6 years, do not try and clean your baby's ears. If the wax is coming outside, take a small cotton and just clean the outer area, and that should be useful. Our next question for the day is, "मा- मैम मेरा सी सेक्शन हुआ है और मुझे 5 महीने हो गए हैं, मैं कब एक्सरसाइज शुरू कर सकती हूँ? मेरा वेट बहुत ही बढ़ गया है, कुछ सजेशंस दीजिए प्लीज़." Now, new mom, this is a very common problem for all the mothers who have delivered. जैसे ही बच्चा 5-6 महीने का हो जाता है, हर मॉम को लगता है कि मेरा वज़न बढ़ गया है और मुझे एक्सरसाइज शुरू करना चाहिए। डेफ़िनेटली ये बहुत ही पॉज़िटिव पॉइंट है। हम लोगों को ये भी समझना है कि आपको आपका ख़्याल भी रखना है, क्योंकि बेबी के अलावा आपका अलग-सा एक रूटीन होता है। चीज़ें नॉर्मलाइज़ करने के लिए भी आपको ध्यान देना पड़ता है। लेकिन पहले देखिए कि अगर आपका सी सेक्शन हुआ है या नॉर्मल डिलीवरी हुआ है, आपके इंटरनल स्टिचेस हील हुए हैं या नहीं। दूसरी बात, एक डॉक्टर से बात कीजिए कि अगर मैं एक्सरसाइज करना शुरू करूँगी और मुझे बैक पेन आता है या स्टमक पेन आता है, तो मैं उस वक़्त कैसे खुद को सँभाल पाऊँगी। तीसरी बात है कि वेट लॉस जो है वो धीरे-धीरे होता है। एकदम से आपने जिम शुरू कर दिया, वज़न उठाना शुरू कर दिया, उसका एडवर्स इफ़ेक्ट आपके शरीर पे हो जाएगा। नॉर्मलाइज़ करने के लिए अगर रूटीन बेहतर बनाना चाहते हो, वॉक करना शुरू कीजिए, योगा करना शुरू कीजिए, पोस्टनेटल एक्सरसाइज़ेज़ शुरू कीजिए, कंगा ट्रेनिंग शुरू कीजिए, जहाँ पे हमारा कोर स्ट्रेंथ होता है अब्डोमिनल मसल्स को स्ट्रेंथन करना। तो अगर यहाँ पे ये एक्सरसाइजेस शुरू कर दिए तो हमारा जो वेट लॉस है वो धीरे-धीरे आराम से 6 महीने से 1 साल में वो दिखाई देगा, और ये बहुत ही बेहतर रहेगा कि हम पोस्टनेटल फिटनेस पे ध्यान दे रहे हैं। तो सिर्फ डाइट ही ज़रूरी नहीं है, हम लोगों को ये भी देखना है कि डाइट के साथ-साथ पोस्टनेटल एक्सरसाइज़ेज़, जैसे मैंने कहा कंगा ट्रेनिंग है, योगा है, वॉकिंग है, ये सब एक डॉक्टर की प्रिस्क्रिप्शन पे ही होता है। खुद से शुरुआत ना करें, क्योंकि साधारण साधारण या आम बात है कि अगर आप खुद से शुरू करोगे तो आपका अब्डोमिनल पेन हो सकता है या आपकी पीठ दुख सकती है। अगर लचक भर गई तो फिर मुश्किल हो जाएगी आपको आगे की एक्सरसाइज करने के लिए। हमारा अगला सवाल यूज़र से ये है कि 6 महीने में हम बेबी को कौन से वैक्सीन्स देते हैं। हमको ये देखना चाहिए कि हर एक बेबी का रूटीन अलग होता है। इसलिए 6 महीने का जो रूटीन है या जो वैक्सीन है, यहाँ पे हमको उनका पोलियो का डोज़ होता है, हेपेटाइटिस बी का डोज़ होता है, 8 महीने के ऊपर उनका एमएमआर का डोज़ होता है। तो हमारा जो वैक्सीन शेड्यूल होता है, वो हर एक हिसाब से उसका एक रूटीन रहता है जो डॉक्टर हमें बताते हैं, और समय-समय पर ये वैक्सीन्स लेना बहुत ज़्यादा ज़रूरी है, क्योंकि ये एक बच्चे को इम्यूनिटी और प्रोटेक्शन देते हैं। सो आई होप ये आपको समझ आया होगा कि आज के सवाल का जवाब क्या था, और आपको बेबी चक्र पे कोई भी सवाल हो तो आप मुझसे पूछ सकते हो। मैं आपकी एक्सपर्ट डॉक्टर पूजा मराठे, आपके सवालों का जवाब देने के लिए मैं रोज़ सोमवार से शुक्रवार 10:30 से 11 आती रहूँगी और आपके सवालों का जवाब देती रहूँगी। सो आज के लिए इतना ही, बस। धन्यवाद।